7 essential vitamins for leg strength. Consider the benefits of awakening each day with legs that exhibit strength, stability, and vitality. The absence of muscle weakness, the elimination of painful cramps, and the alleviation of concerns regarding balance or falls are now achieved. To maintain an active, independent, and confident lifestyle, it is essential to prioritize proper nutrition. Today, we will discuss 7 essential vitamins and minerals that contribute to maintaining the strength and functionality of the legs. The enhancement of muscle function, preservation of bone density, and improvement of circulation are significant benefits associated with these essential nutrients, which can markedly influence daily mobility and overall well-being. This video is designed for individuals who enjoy engaging in activities such as walking in the park, dancing, or maintaining their independence. Before we commence, I would appreciate knowing your current location of participation. Please leave a comment below and do not hesitate to inquire about any questions you may have. We encourage you to subscribe and activate notifications to ensure you remain informed about the most effective health tips provided by Health 365. Let us collaboratively establish a future characterized by enhanced health and strength. Initially, it is important to discuss vitamin D. With advancing age, the human body experiences a series of physiological changes. The reduction of muscle mass, the decrease in bone density, and the increasing difficulty of movements that were previously effortless are notable physiological changes that can occur over time. A frequently underestimated factor contributing to this decline is a deficiency in vitamin D. The implications extend beyond the mere fragility of bones. This vitamin is essential for maintaining the strength, balance, and overall functionality of the legs. An in-depth examination of the role of vitamin D reveals its critical importance in promoting leg strength among the elderly. Ensuring sufficient intake of this nutrient can significantly enhance mobility and contribute to overall well-being. With advancing age, the skin's capacity to synthesize vitamin D from solar exposure diminishes. Additionally, numerous elderly individuals experience reduced outdoor activity as a result of mobility constraints, alterations in lifestyle, or apprehensions regarding potential skin damage. The outcome? A prevalent deficiency that insidiously diminishes muscle strength, resulting in weakened and unstable lower extremities. Research has consistently demonstrated a correlation between insufficient levels of vitamin D and muscle weakness, as well as an elevated risk of falls among the elderly population. Research published in the Journal of Clinical Endocrinology and Metabolism indicates that older adults with adequate vitamin D levels exhibit enhanced muscle fiber strength, improved coordination, and superior balance, thereby reducing their susceptibility to injuries and fractures. Conversely, individuals with a deficiency exhibited accelerated muscle atrophy, resulting in increased difficulty with fundamental activities such as ascending stairs or rising from a seated position. Vitamin D plays a role beyond calcium absorption and bone health, although these aspects are indeed significant. This essential vitamin significantly influences muscle function through the enhancement of protein synthesis and the improvement of neuromuscular communication. Consider it as a source of energy for the musculature of the lower extremities. In the absence of this factor, individuals may experience difficulties in achieving optimal performance. Research indicates that vitamin D is essential for the maintenance of fast-twitch muscle fibers, which are vital for rapid responses and balance. The fibers play a crucial role in fall prevention by enabling the legs to react swiftly when balance is disrupted. Insufficient levels of vitamin D can result in the deterioration of muscle fibers, which may contribute to slower reaction times, diminished muscle contractions, and an increased susceptibility to injury. Furthermore, vitamin D has been shown to mitigate inflammation within muscle tissues, thereby providing relief from chronic pain and discomfort commonly reported by the senior population in their lower extremities. Individuals experiencing recurrent cramps, stiffness, or unexplained leg pain may find it noteworthy that optimizing vitamin D levels can result in considerable alleviation of their symptoms. Neglecting vitamin D deficiency can lead to compromised musculoskeletal strength and may predispose individuals to a range of significant health complications. The most concerning aspect? Osteoporosis is a condition characterized by decreased bone density, leading to an increased risk of fractures. Fractures associated with osteoporosis commonly occur in the hip, spine, and wrist, often resulting from minimal trauma. It is essential to assess bone health and implement preventive measures to mitigate the risk of such injuries. Inadequate levels of vitamin D can impair calcium absorption, resulting in increased bone fragility and a heightened risk of fractures. A minor misstep has the potential to result in a significant fracture, which could severely impact an individual's mobility and autonomy. In addition to its role in musculoskeletal health, a deficiency in vitamin D has been associated with elevated risks of cardiovascular disease, cognitive impairment, and compromised immune function. Older adults who fail to maintain adequate vitamin D levels may experience not only diminished lower extremity strength, but also an increased risk of chronic health conditions that can adversely affect their overall quality of life. What is the proposed solution to this issue? Maintaining optimal vitamin D levels is a straightforward process that can result in significant health benefits. The following are the most effective methods to enhance vitamin D levels and maintain strength and stability in the lower extremities. Exposure to sunlight. Engaging in direct sunlight exposure for a duration of 15 to 30 minutes, particularly during the morning or late afternoon, can yield beneficial effects on overall well-being. Exposing the arms and legs can enhance the absorption of sunlight. However, it is important to consider the application of sunscreen, as it may inhibit the synthesis of vitamin D. Foods that are high in vitamin D. Although dietary intake alone may not suffice to fulfill daily nutritional requirements, the inclusion of fatty fish such as salmon, mackerel, and sardines, along with fortified dairy products, egg yolks, and mushrooms can enhance overall nutrient consumption. Dietary supplements. For numerous elderly individuals, particularly those who have restricted outdoor exposure, the supplementation of vitamin D is crucial. It is generally advised by professionals to intake between 800 to 1,000 IU daily to support optimal bone and muscle health. However, individuals with significant deficiencies may require higher dosages, which should be administered under medical supervision. Should there be any uncertainty regarding your vitamin D levels, a straightforward blood test can offer definitive insight. It is increasingly common for healthcare providers to assess vitamin D levels in older adults, acknowledging its essential function in mitigating the risk of falls and fractures. Calcium is an essential mineral that plays a critical role in various physiological processes within the human body. In contrast to younger individuals whose skeletal systems are characterized by ongoing remodeling processes, older adults undergo a progressive decline in bone mass, thereby increasing their vulnerability to fractures. This condition poses a significant risk to the lower extremities. Hip fractures, femoral fractures, and stress fractures in the lower extremities represent significant injuries commonly encountered in the geriatric population. A minor fall that may have been inconsequential in youth can lead to extended recovery periods, or even permanent loss of mobility when bones are deficient in essential calcium reserves. Calcium's function extends beyond merely contributing to bone density. It serves as an essential component in the process of muscle contraction. Each movement, whether it involves ambulation or transitioning from a seated position, is dependent on a sophisticated interaction between calcium ions and muscle fibers. Calcium serves as a crucial initiator for muscle contraction, facilitating smooth and regulated movement. Insufficient calcium levels can lead to muscle cramps, weakness, or an inability to produce the necessary force for maintaining stability. Individuals with calcium deficiency often present with symptoms such as frequent leg cramps, decreased mobility, and an overall decline in muscle endurance. What strategies can be employed to ensure adequate calcium intake for optimal bodily function? Dairy products such as milk, yogurt, and cheese are among the most abundant sources. However, they are not the sole alternatives available. Leafy greens such as kale and bok choy, along with almonds, tofu, sardines, and fortified plant-based milks, are recognized for their substantial calcium content. Diversity is essential. The inclusion of various calcium sources in one's diet promotes consistent absorption and enhances bone health maintenance. Calcium obtained solely from dietary sources may not consistently meet the needs of individuals. particularly those with specific dietary restrictions or absorption challenges. Calcium supplements can serve an important function, especially when taken in conjunction with vitamin D, as this vitamin facilitates the absorption of calcium within the body. However, an increase in quantity does not necessarily equate to improved outcomes. Calcium is a vital nutrient. However, excessive consumption, especially from supplemental sources, may result in the formation of calcium deposits within arterial walls, the development of nephrolithiasis, and gastrointestinal complications. Achieving an appropriate equilibrium is essential. In older adults, the advised daily calcium intake ranges from 1,000 to 1,200 milligrams, ideally obtained through a combination of dietary sources and supplementation as needed. In addition to dietary intake, another critical factor influencing the efficacy of calcium is physical movement. Weight-bearing exercises, including walking, resistance training, and light jogging, promote bone remodeling and facilitate the appropriate distribution of calcium to the bones and muscles where it is most needed. In the absence of physical activity, even sufficient calcium consumption may not effectively enhance the integrity of the skeletal system. Inadequate calcium intake has implications beyond the deterioration of bone density. This condition impairs individuals' capacity for unrestricted movement, limits participation in cherished activities, and undermines personal autonomy. The foundation of a life characterized by mobility, stability, and confidence is rooted in robust skeletal integrity and optimal muscular function, both of which are contingent upon adequate calcium levels. 3. Vitamin B12 is often overlooked in discussions regarding leg strength, which typically emphasize calcium and protein. However, it is essential to recognize that vitamin B12 is crucial for proper neuromuscular function. This function is crucial for maintaining nerve health, as it ensures that the electrical impulses transmitted through the spinal cord to the lower extremities are robust and accurate. In the absence of this factor, the muscles fail to receive appropriate signals, resulting in weakness, instability, and a gradual decline in motor control. One of the prevalent manifestations of vitamin B12 deficiency is the sensation of heaviness and fatigue in the legs, frequently associated with paresthesia, such as numbness or tingling. However, there exists a concern. Vitamin B12 deficiency is notably prevalent in the older adult population. In contrast to other vitamins that can be stored in adipose tissue or obtained from a diverse array of dietary sources, the absorption of vitamin B12 is significantly reliant on the integrity of the gastrointestinal system. The human body necessitates sufficient gastric acid and a specific protein known as intrinsic factor to effectively absorb vitamin B12 from dietary sources. With advancing age, there is a reduction in the production of stomach acid, which can lead to conditions such as gastritis and acid reflux. Additionally, prolonged use of antacids may further compromise nutrient absorption. Additionally, it is important to note that numerous elderly individuals may inadvertently adhere to diets that are deficient in foods rich in vitamin B12, leading to a gradual yet consistent decline in this vital nutrient. The ramifications of vitamin B12 deficiency are extensive and encompass more than merely experiencing fatigue. Unaddressed vitamin B12 deficiency may result in permanent neurological impairment, which can compromise balance, coordination, and reflexive responses. A significant number of elderly individuals who encounter recurrent falls, challenges in ambulation, or a perception that their lower extremities are not functioning as they once did may be experiencing the neurological consequences associated with a deficiency in vitamin B12. The decline frequently occurs in a manner that is so gradual it may be overlooked as a typical aspect of the aging process. In actuality, it is completely preventable. Restoring vitamin B12 levels can significantly influence mobility and enhance energy levels. Research indicates that older adults who address their deficiencies demonstrate significant enhancements in strength, endurance, and lower extremity function. What are the sources of this essential vitamin? In contrast to numerous other nutrients that are derived from plant sources, vitamin B12 is predominantly located in animal-derived products. Optimal sources of nutrition encompass lean meats, fish, eggs, dairy products, and shellfish, with particular emphasis on clams and liver, which are recognized as some of the most nutrient-dense options available. Individuals adhering to plant-based diets or experiencing difficulties with nutrient absorption may find it necessary to incorporate B12 fortified foods, including cereals and plant-based milk, or to consider B12 supplementation as a critical component of their nutritional regimen. The positive aspect is that vitamin B12 is considered one of the safest vitamins for supplementation, as any excess quantities are typically excreted through urine. Numerous older adults may experience advantages from the administration of higher-dose vitamin B12 supplements or periodic injections, particularly in cases where there is a challenge in the absorption of this nutrient through dietary sources alone. Consistent evaluation via blood tests is essential for maintaining optimal levels and preventing the progressive deterioration of leg function commonly associated with deficiency. However, the primary conclusion to be drawn is as follows. The development of strong legs encompasses factors beyond mere physical strength. The focus is on the efficiency of the nervous system, reaction time, and coordination. Regardless of the extent of physical exercise undertaken, if the neural pathways are not functioning optimally, the lower extremities will not exhibit the expected responsiveness. Maintaining adequate levels of vitamin B12 is a critical yet often overlooked strategy for preserving mobility and enhancing quality of life as individuals age. 4. Magnesium is an essential mineral that plays a critical role in various physiological processes within the human body. With each step taken, magnesium functions in a crucial supportive capacity, facilitating the transmission of signals necessary for the proper contraction and relaxation of muscles. This substance serves as the primary regulator of muscle function, inhibiting spasms, decreasing fatigue, and enhancing endurance. Restless leg syndrome and frequent nighttime leg cramps are among the most prevalent yet often overlooked manifestations of magnesium deficiency. Numerous elderly individuals report experiencing abrupt and painful muscle contractions in the lower extremities, particularly during nocturnal hours. This phenomenon can significantly disrupt sleep patterns and hinder recovery from daily activities. This condition represents more than mere discomfort. This indicates that the body is experiencing difficulty in effectively regulating muscle relaxation mechanisms. Magnesium plays a crucial role in modulating hyperactive nerve signals and preventing unexpected muscle contractions, thereby serving as an essential mineral for individuals experiencing muscle tension and involuntary spasms. However, the role of magnesium extends beyond its function in muscle physiology. It is essential for maintaining bone density and supporting joint health. Calcium is frequently recognized as a critical nutrient for bone health. However, its efficacy is significantly enhanced by the presence of magnesium. This mineral plays a crucial role in the regulation of calcium transport, ensuring its appropriate incorporation into bone tissue, rather than allowing deposition in soft tissues, which may lead to stiffness and joint discomfort. Research indicates that increased magnesium consumption is associated with enhanced bone density and a lower incidence of fractures among older adults, highlighting its critical role in maintaining overall mobility. Magnesium deficiency is frequently observed due to its susceptibility to depletion from factors such as stress, pharmacological interventions, and inadequate dietary practices. A significant number of older adults are prescribed medications that can result in decreased magnesium levels. These include diuretics, proton pump inhibitors, and specific antihypertensive agents. The combination of diets deficient in magnesium-rich foods leads to a prevalent deficiency that gradually undermines strength, endurance, and flexibility. Many seniors often exhibit a progressive decline in stamina, resulting in shorter walking distances, a slower pace when climbing stairs, and increased fatigue following routine activities. The decline in performance is not solely attributable to age. Rather, it is significantly influenced by an inadequate intake of essential nutrients necessary for optimal physiological function. Restoring magnesium levels can yield prompt benefits for leg health, including a reduction in cramps, enhancement of energy levels, and a return to ease of movement. Optimal dietary sources of magnesium encompass leafy green vegetables, various nuts, seeds, whole grains, and legumes. Foods such as pumpkin seeds, almonds, spinach, black beans, and avocados are notably high in magnesium, providing a natural approach to support muscle and bone health. For individuals who find it challenging to obtain sufficient magnesium through dietary sources alone, the use of magnesium supplements may serve as a viable intervention. Specifically, magnesium citrate and magnesium glycinate are noted for their enhanced bioavailability, facilitating improved absorption by the body. The physiological changes that take place upon the restoration of magnesium levels are noteworthy. Older adults who previously experienced feelings of heaviness and lethargy in their legs may observe a significant improvement in their mobility and energy levels. Individuals experiencing recurrent muscle cramps or stiffness report significant relief, which contributes to improved sleep quality and enhanced mobility. Balance and coordination are enhanced, as magnesium plays a crucial role in regulating the neuromuscular connections that facilitate steady movement. 5. Potassium is an essential mineral and electrolyte that plays a critical role in various physiological functions within the human body. It is vital for maintaining proper fluid balance, nerve transmission, and muscle contraction. Adequate potassium levels are necessary for optimal cardiovascular health and overall metabolic processes. Consider the scenario of awakening in the morning, rising from a supine position, and experiencing an acute cramp in the calf muscle. Does this resonate with you? Muscle cramps represent a prevalent manifestation associated with hypokalemia. Potassium serves as a crucial regulator of muscle function, playing a significant role in maintaining fluid balance both intracellularly and extracellularly within muscle cells. Hypokalemia, or low potassium levels, can result in involuntary muscle contractions, manifesting as painful cramps, particularly in the lower extremities. In older adults who may present with diminished circulation or reduced muscle mass, these cramps can transcend mere annoyance and may indeed become debilitating. However, muscle cramps represent only the initial manifestation of the condition. Have you ever experienced tremors in your legs following a period of standing? Alternatively, you may have observed a heightened degree of stiffness during ambulation. Potassium plays a crucial role in the transmission of signals between nerves and muscles, facilitating smooth and controlled movements. When levels are diminished, the efficacy of communication between the brain and the leg muscles is compromised, resulting in symptoms such as tremors, muscular weakness, or challenges in properly elevating the feet, which can markedly elevate the risk of falls. It is essential for the elderly population to prioritize fall prevention. In addition to its well-documented functions in muscle physiology, potassium has been identified as a crucial element in the maintenance of bone integrity. This process assists in neutralizing acids within the body that may contribute to the degradation of bone density over time. Research indicates that a diet high in potassium may attenuate the rate of bone resorption, thereby decreasing the likelihood of developing osteoporosis and maintaining the structural integrity of the lower extremities. Potassium plays a crucial role not only in muscle function, but also in the synergistic operation of both the muscles and bones in the lower extremities. It is essential to consider how to adequately obtain potassium to support optimal leg function. Fortunately, nature has endowed us with a variety of palatable foods that are rich in potassium. While bananas may initially be the most recognizable option, they represent merely the starting point in a broader context. Sweet potatoes, avocados, spinach, beans, and oranges are recognized as significant sources of potassium. A baked potato, particularly when consumed with the skin, can offer a higher potassium content compared to that of a banana. It is essential to integrate a diverse range of these foods into your daily dietary regimen to ensure that your muscles and bones receive adequate and consistent nourishment. For individuals who find it challenging to obtain sufficient potassium through dietary sources alone, the use of supplements may appear to be a convenient solution. The recommended daily intake of potassium varies based on age, sex, and individual health conditions. Generally, adults should aim for approximately 2,500 to 3,000 milligrams per day to maintain optimal physiological function. The advised daily intake for adult females is 2,600 milligrams, while for adult males, it is 3,400 milligrams. This quantity is generally attainable through a nutritionally balanced diet that includes an abundance of fruits, vegetables, and legumes. Individuals with health conditions that influence potassium levels, including renal disease or hypertension, must closely monitor their intake and collaborate with a healthcare provider to establish the appropriate amount. 6. Vitamin K is frequently overlooked when discussing vitamins critical for maintaining strong bones, as calcium and vitamin D typically dominate the conversation. In the absence of vitamin K, the efficacy of these nutrients is significantly compromised. Vitamin K serves as an essential factor in facilitating the proper deposition of calcium in the skeletal system, thereby preventing its accumulation in arterial walls or soft tissues. This misplacement of calcium can contribute to conditions such as arterial stiffness, compromised circulation, and an increased risk of cardiovascular disease. Vitamin K functions as a regulatory agent, directing calcium to appropriate sites within the body, thereby contributing to the structural integrity and mobility of the legs. For the elderly population, this consideration becomes increasingly vital. Research indicates that individuals with elevated vitamin K consumption exhibit enhanced bone strength, reduced fracture risk, and improved overall bone health in comparison to those with diminished levels. Vitamin K plays a crucial role in the activation of osteocalcin, a protein that facilitates the binding of calcium to the bone matrix. This process contributes to increased bone density and enhances resistance to fractures. However, the role of vitamin K extends beyond that. This nutrient plays a critical role in maintaining joint health and supporting optimal muscle function. It is often underestimated that optimal leg health necessitates not only robust skeletal structure, but also adequate joint flexibility and effective muscular function. Vitamin K has demonstrated efficacy in reducing joint inflammation, which may contribute to the deceleration of osteoarthritis progression and the alleviation of knee stiffness, frequently reported by the elderly population. Experiencing knee discomfort during movement or stiffness following prolonged periods of sitting may indicate a deficiency in vitamin K. This nutrient could potentially alleviate discomfort and promote improved mobility. Impaired balance, challenges in ambulation, and an elevated risk of falls are frequently associated with diminished strength in the lower extremities. Recent studies indicate that vitamin K may play a role in enhancing muscle strength and coordination, especially among the aging population. This mechanism operates by modulating calcium concentrations within muscle cells, thereby facilitating appropriate contractions and mitigating the risk of uncoordinated movements that may result in instability. Spinach, kale, Swiss chard, collard greens, and Brussels sprouts represent some of the most abundant dietary sources of vitamin K1, which is the predominant form of this vitamin found in plant-based foods. Vitamin K2, a potent variant of the vitamin, is present in fermented foods such as natto, aged cheeses, and specific animal products including egg yolks and liver. Vitamin K2 exhibits significant advantages due to its prolonged activity within the body, facilitating a more effective role in the transportation of calcium to the bones as opposed to the arteries. To enhance your vitamin K levels through natural means, it is advisable to augment your consumption of green vegetables and fermented foods. Incorporating a daily serving of kale into a smoothie or adding a side of sautéed spinach to your meal can significantly enhance nutritional intake. For individuals experiencing challenges in the absorption of vitamin K from dietary sources, particularly those with gastrointestinal disorders or those undergoing prolonged antibiotic therapy, the consideration of supplementation may be warranted. However, it is essential to exercise caution. Patients who are prescribed anticoagulant therapy, such as warfarin, should seek guidance from a healthcare provider prior to making any adjustments to their vitamin K consumption. This is due to the critical role vitamin K plays in the coagulation process and its potential interactions with anticoagulant medications. 7. Vitamin B6 or pyridoxine is significantly more influential in leg strength and muscle function than is commonly understood. Numerous nutrients play a role in mobility. However, vitamin B6 is particularly crucial for the maintenance of nerve health, the facilitation of muscle repair, and the optimization of protein utilization for the development and preservation of muscle mass. In the absence of this factor, even the most robust musculature may experience a decline in strength over time, leading to increased fatigue during basic activities such as rising from a seated position or ascending stairs. One of the frequently underestimated aspects of vitamin B6 is its association with nerve signaling and coordination. Low levels of vitamin B6 can result in impaired signaling, which may manifest as numbness, tingling sensations, and unsteady gait. Numerous older adults often misinterpret these symptoms as being attributable to age-related muscle degeneration. However, the underlying issue may be a deficiency in essential nutrients necessary for optimal neuromuscular function. Vitamin B6 plays a significant role in mitigating inflammation-related muscle fatigue. Vitamin B6 plays a crucial role in modulating inflammatory responses within the body, thereby alleviating muscle discomfort and promoting enhanced flexibility and resilience in the legs. Should you be encountering ongoing stiffness or a prolonged recovery period following physical activity, augmenting your vitamin B6 intake may prove beneficial. In addition to its role in muscle function, vitamin B6 is essential for the production of red blood cells. The primary function of these cells is to facilitate the transport of oxygen throughout the body, thereby providing essential support to muscle tissues and ensuring they possess the requisite endurance for prolonged physical activity. A deficiency in vitamin B6 can result in decreased hemoglobin levels, potentially leading to inadequate oxygen delivery to the muscles. This may manifest as early fatigue, a sensation of heaviness and diminished stamina. Experiencing excessive fatigue following minimal physical activity, such as short walks or light exertion, may indicate a potential deficiency in vitamin B6. It is advisable to consider this possibility in the context of your overall health and nutritional intake. What are the sources of this essential vitamin? Fortunately, vitamin B6 is readily available in a diverse array of palatable and easily obtainable food sources. Poultry, fish varieties including salmon and tuna, bananas, potatoes, chickpeas, and fortified cereals represent highly beneficial sources of nutrition. Integrating these foods into daily dietary practices can effectively restore your B6 levels, thereby promoting optimal nerve function and enhancing muscle strength. In patients experiencing digestive disorders, inadequate nutrient absorption, or specific dietary limitations, the supplementation of vitamin B6 may be indicated to attain optimal serum levels. The advised daily consumption of vitamin B6 is contingent upon age and sex, with older females generally requiring approximately 1.5 milligrams per day, while older males typically necessitate about 1.7 milligrams per day. While it is typically considered safe to acquire vitamin B6 through dietary sources, caution is advised regarding excessive intake from high-dose supplements, as prolonged overconsumption may result in neuropathy. A comprehensive approach involves prioritizing a balanced diet that is abundant in sources of vitamin B6, thereby ensuring a consistent intake while minimizing potential health risks. If you found this video beneficial, kindly consider pressing the like button. This approach significantly enhances our ability to provide you with more valuable content. Please provide your feedback, inquiries, or suggestions for future topics in the comment section below. Your feedback is greatly appreciated. We encourage you to subscribe and activate notifications to ensure you remain informed about our most recent health tips and insights. Maintain awareness of your health, adhere to wellness practices, and we look forward to your engagement in the subsequent video.